New Africa Broadcasting Network.
Back to the diasporans making a difference. Like I said, if we put some of these brains here together and do something with it, the world's going to be a dangerous place. Just the Nigerian minds alone. So our next diaspora making a difference, I call him Dr. Brainiac. I mean, this man, well, he says he's a mature man, but to me, he looks like a young man with such huge talent. So, Dr. Ikudayisi, I am so honored to have you come up here and let this audience know what you have been doing here in this country. And in fact, he just flew back from Nigeria just to join us here because he's also doing it in Nigeria in the medical field. And I honestly don't believe that what he does here, that there's so many actually Americans doing it. That's why I really applaud our Nigerian brainiacs. Come on, Dr. Ikudayisi. You'll be so amazed what this man does.
Allow me to stand on all existing protocol. With due respect, all protocol observed. My name is David Ikudayisi. I'm a US board certified internist. I started my medical journey in Nigeria until university was closed down. Then I crossed over to Russia on scholarship. And after that, I came to US to further my education. I'm also a geriatrician by fellowship and as well as a regenerative medicine specialist, which is what I've been taking to Nigeria. I've been going to Nigeria for over 3 years now, every three months. Like, you're going to hear more, and like other speakers have said, do business in Nigeria is not easy. And what I'm going to do, before I even tell you about what I do as a physician in Nigeria, is share my experience, my challenges with you, how I've been able to overcome them by the supports in Nigeria. So I'm going to just pick a couple of things. We all know about the poor infrastructure problems, you know, about the roads, the electricity. There's not two ways around that right now. You just need a generator, inverter, and they hope that you get more of the electricity from the government. So nothing around that. Now, the next thing that is important is the quality of products and services in Nigeria. On one occasion, I decided to get a product, or let me put it this way. What I've been doing is that because of quality, assurance that yet I couldn't trust. So whatever I'm doing in Nigeria, I take everything from US. So that way, nothing is compromised. My patients are not getting any substandard treatment. The only difference is just the four corners of the room where I treat them. So that is from A to Z. So on this occasion, I got a local product. Normally, I should get results within 1.5 hours. 4 hours, I couldn't. And then, again, about this my last trip, I sent a container that in US, with that size, your liquid nitrogen should be there for minimum of 4 months. I went back to Nigeria. 2 months later, there was nothing left. And I had a lot of very expensive stuff in that. I had to just stand up for 5 minutes against the wall and just take a deep breath. That's all I could do. I mean, I don't want to hear the number. So just forget about that. Now, for medical, I think for accountants, lawyers, and doctors, in Nigeria you cannot market. Unlike here, market is allowed. So you have to provide good quality service and allow the word of mouth to, be your marketing source. So that's how, I believe doctors can get around that. The other part is the cash flow management. All these things you will hear people talking about later on. I'm just sharing my own. And that, our environment, I don't know how you can survive without giving credits. But depending on the kind of business that you do, because medicine is different. And what I do is not emergency. I will spend another maybe 10 minutes explaining to you what I do. It's elective. So with that, I've been able to overcome that. And finally, is getting people to understand what I do, which is regenerative medicine. It's a kind of, about 12, 13 years old area of medicine, and it's actually the future of medicine, whether I would like it or not. And my goal is to, either with larger groups down the road, make Nigeria the medical tourism center. Because we have brains in Nigeria, even those of us that are outside, and not only medical, in all aspects of life, you always find Nigeria at the top place there. So why do Nigerians have to be traveling to India, China to get medical treatment? I mean, we can bring them in, give them that quality of treatment in Nigeria. And then that involves evidence-based medicine too. In advanced stage cancer can be cured. Okay? There are 3 centers in the whole world. One is in California, UK, and Germany, whereby if you combine what I do with the medication, I will show you one slide down the road. The size of tumor can be reduced. The tumors of cancer that have traveled far can be taken care of. The patient will have good quality of life. You can add about 3-4 years to their life, whereas maybe chemotherapy or radiation therapy will only by them 3, 6, or 9 months. Now, I'm talking about challenges. Then let me say, Poland and Nigeria is technically be fighting to be number 4, number 5 to have that safe clinical practice in Nigeria. But getting the product from a certain department of Nigerian government is what is holding Nigeria to be number 4, number 5. I mean, I've been to the ministry, they are happy, but we have our bureaucracy and stuff like that. And the blueprint is being promised, but I hope maybe sooner or later that can be. Can you imagine if people all in Africa can be coming to Nigeria for their cancer treatment? No side effect, not like chemotherapy or radiation therapy, okay? It's something from that patient's own body, so there's no risk of rejection. The issue is this: the product I'm talking about has been proven to be safe. What I'm doing has been proven to be safe. You will assume that combination of both of them are safe. Yes, that is true, but in Western world, you can't just make that assumption. You have to go through clinical trials before you can now call it a treatment. So everybody in those 3 countries I mentioned, there has been no side effect, there has been perfect result, but just something that they have to do. But we're talking about having an African country to join them, and the MOU is still sitting on the table. So you can imagine the challenges. But that's part of doing business in Nigeria. When you're trying to help. But I know with perseverance, determination, one will overcome. So quickly, I believe that there are great opportunities in Nigeria because until it's going to be the next. There's a lot of opportunities in Nigeria. If you can just continue believing in your goal and be perseverance, and then with time, if you don't put the money first, if you have passion for what you do, you always get to where you need to be. And then, like the other speaker earlier before me said, about he has shown, you create opportunities. I just started about 3 weeks ago, in after New Year, my own clinic in Lekki Boswan. I've employed a couple of young people, talented people, medical teams. So I already started making implants. And with the help of NABF, some of the members who have already established in Nigeria, they're able to give me guidelines and tell me what to do. So that's another benefit from being a member of this group. So please take note. And this is one slide I wanted to show you. I missed out on the initial size, but this slide is a tumor of the neck, for example, that has also traveled far in the body. You can see within, that will be roughly 4 months, that, and that's using the person's stem cell from the body, which I've been talking about. Now, so what is regenerative medicine? That's pretty much what I've been talking about. And at the end, I'm going to show you a 2 minutes video. I know the doctors will appreciate it. Last year, I showed a 1 minute video of a condition called motor neuron disorder that is a more like, once you are diagnosed, you keep going. And then what I do within 3 months was able to reverse some of the symptoms. This year, the video is going to be different. I think we all appreciate it at the end. So I won't say anything much yet about that. So what is regenerative medicine? It's just, let me put it this way. Whatever, the way God created us is for us to heal ourselves. That's why the kids, when they break their bones, they heal faster. As you get older, it takes longer. Now, science just found a way to accelerate this healing process. And the beauty of it is using something that is already in your body that God gave you. So it's a process of repairing and restoring things back to normal. That's what regenerative medicine is all about. But that might be the way Mayo Clinic define it. It says, when we Orthodox doctors have said this is over, take this medication for the rest of your life, or if you have stroke or paralysis, just deal with it. Regenerative medicine says no, we're just getting started. So that's what this is all about. And that comprises using the blood, which is, I refer to as therapy of platelet-rich plasma, or using stem cells. But out of the different types of stem cells, it's only adult stem cell that is clinically proven, because in US, you have to harvest that, give it the same day back to the patient. Like if somebody can go, a woman can go to a doctor, collect the fat from the abdomen, put it in the lips, just for cosmetic, and send it on. But if you do anything more than that, or manipulate it more, the next day that becomes drug, and that's still not allowed in the clinics. So the first part will be the blood, PRP, and the second part will be stem cell. So what is PRP? That's when you donate blood, and the doctor process it, get a certain portion of it, and kind of release the growth factors in your body to stimulate, accelerate the repair process in your body. Again, using your own blood to repair damages, in your body. And what you get is permanent tissues. Many hospitals are using that in USA because it helps them to keep patients out of the hospital. If that patient, let's say, you go for surgery in US, the doctor is paid, the hospital is paid. If that patient comes back within 30 days, they don't get paid, but they have to treat the patient. So they use it to accelerate the healing process, or maybe even keep them out of that 30 days period. So like I was saying earlier, it's just all natural in your body. If you cut your hand in the kitchen by mistake, you put pressure to stop the bleeding. What you're actually doing is you're activating those platelets. Platelets are cells without nucleus. You notice some yellow soapy stuff. 2-3 days is painful swelling, maybe 5 days, the scar forming, 3 weeks, you are healed. So that is how we are naturally created, and that is what regenerative medicine is all about. Now, what is stem cells? Keep in mind, all of us in this room, we came from a fertilized ovum, a sperm and a egg. That one cell became 2 became 4. Eventually, your head, your hand, everything differentiates. So that's what stem cell is all about. Any cell that can multiply or differentiate into different organs. So where do you get them from? Bone marrow, fat, umbilical cord. None of us in this room can use our own umbilical cord, even if you know where your parents buried it. It's gone. So therefore, we cannot, even though I know I said it earlier, your own body parts, So that's why nowadays in UK, US, everywhere, when babies are born, they ask the mother, do you want us to keep sample of the blood? So that 30 years down the road, if that baby develop a problem, they can use that baby's own body part to repair, or regenerate whatever the issue is. So what can you do with this so-called regenerative medicine? Let's take the blood, for example. You can use it for cosmetic reasons. You can, for example, women run around, they sneeze, they cough, they are, they're embarrassed because of leaking urine. You can use their blood, to fix that easily, no side effect. We don't have Viagra for women. If you use it, what you call your dead, it restores back their youthful time, and then they have been the one complaining, don't touch me, it's the other one that will run around. There's light in the house, I'm not going in. That's how it is. Men are not left out, okay? You can use it for strength, stamina, length, and weight, hair growth, wounds, orthopedics love it, and all these have evidence based on the U.S. National Institute of Health. So if anybody's interested, you can look into that. You get something like this. I don't know if that's showing the yellow passage of conclusion. But PRP is safe, effective, it saves money, it saves the patient money and improves quality of life. That's talking using wound. Actually, the next slide I'm going to show you it's a Nigerian that I treated with wound problem. I wrote an article, submitted it, and it was accepted and published in the Journal of Medical Cases in the first week of October last year. And this is a patient with spinal cord injury at the neck level. I know you are not physicians, but you can notice on the board there's a difference, there's brain, where you see that C5 to C7, you see something looks like it's wrong there. So that's where the problem is. Because of that, the patient could not move the anything from the waistline down. And so it developed wound on the buttocks that will not heal, just using the patient's own blood. And stem cells from his fat. You can see what happened in 6 days, just one treatment. No special instruction on dressing or nothing. You can see what happened 3 weeks later, and you can see what happened 2 months later. So that's the power of what God has given us. So you can use it for joint pain, knee pain, hip pain, cosmetic, hair loss. This is a patient I treated 5 years ago in Florida here. She should be looking older. She's looking younger 2 years later. Black people are not left out. That was last year. You can use for acne. You can use for hair loss in female, in men. And then, that is, you can say, somebody with a shiny Lagos by the expressway. I'm sorry, So, in as much as I still like it, my wife wants me to be keeping my hair on. But what actually led to the treatment is, I was telling the patient one day, you can do this, and the patient looked at me, looked at my head, and said, "Not," but I got the message. So I went on and decided to, do the treatment for myself. I mean, the next time, of course, you agree with me that the one on the right is better than the first one on the upper left. But I didn't get afro like Dr. Halls there. At least it looks better. Now, what can you do with stem cell? The list of what you cannot do is shorter than the list of what you can do. So the easiest way is anywhere there's the tissue degeneration, stem cell may be able to help. And that leads us to common diseases in Africa, in Nigeria, for example, diabetes, whether it is type 1 or type 2, you can take care of that. Autoimmune disease, rheumatoid arthritis, lupus, skin condition, just name it. The list just keep going. Fibromyalgia, there's no amount of MRI blood work you do that can find a diagnosis. You do stem cells, bingo. It's a new life that a person has. Whether it is back pain, neck pain, disc problem, heart condition, arthritis, stroke, all these lung conditions. We already spoke about sexual functions. So pretty much, you can use it for many things. And I mentioned again about whether it's lung cancer. I already spoke about tumor. This, you can imagine how many, somebody at least knows someone who died of cancer. Can you imagine now, Nigeria having the center to be able to provide something that is clean, no side effects, taken from that patient, give them quality of life. And I mean, this medication is available in all countries, but you can't buy it in pharmacy. You can only get it through the government. Because everybody's waiting for when there will be terrorist attack. So therefore they've taken it off the shelf. And when it expires, they throw it away. All we're asking for just about 50 to 200 pieces to conclude the clinical research, so that way, the formula everything will be there in Nigeria, and others will be coming all over trooping in. So I hope that project will get completed one day. So we are going to die one day anyway, whether we like it or not. Stem cell or no stem cell. I know we just want a good quality of life, and so if there's nothing wrong, you can get smarter, memory improved, energy, sleep better, you use it for anti-aging. So that's something to consider. I'm almost done now. I just want to show you a couple of slides before the video. This is just one of my patients treated, neck pain, elderly lady, 78 years old. Within 5 days, the hand tremor is gone, memory improved, and within 2 weeks, the daughter texted me telling me that the back pain is gone. What I just want us to pay attention to is or maybe I should use this to explain how this works. Stem cells, or let me say adult stem cell therapy, when you go for that, the stem cell the doctor is putting in you does not know your diagnosis. It does not matter whether the doctor got the diagnosis right or wrong. What is common is that every abnormal cells in the body has what we call SDF1 factor. And stem cells have what's called, toll-like receptor, LTR, which means there's going to be that homing effect. The stem cells have been attracted to every part of the body where there's a problem. So when they get there, they just ask the body to repair itself. End of story. So you may take or have diabetics, but when you get treatment, you're going to find out that, your memory is better, your arthritis is gone, your sleeping is distant, because it does not matter. That's why if you see that slide, the lady, they came for all those things I listed up, but the comment of the daughter is, she also has had severe dry eye problems to where she would wake up many times for drops. Since this procedure, she has noticed no problem with eyes. That is within 2 weeks. They didn't complain of that to me. I just give an example of, it doesn't matter, it just fixes. It fixes everything. Even somebody has had surgery in the neck before, back pain, it takes care of that. Whether it is neck pain, Crohn's disease, the guy said it's iffy, 5 days later, he says for 15 years problem, that has done. And this somebody came in, wheelchair, within 3 months, is able to walk around without cane. And these are one of our top government officials in Nigeria who had a stroke. Luckily for him, it's 3 weeks, and was able to, have no left over problem. And now the final slide. Before I play this slide for you, it's about 1 minute, 50 seconds. I'll just explain quickly to you what you're going to see. This is a poor kid. It was age 15 then, playing in high school, the secondary school. They turned his head upside down and dropped him. So immediately became paralyzed from the nipple down. So no sensation, nothing. Immediately, it was, taken to operating room. One of our top neurosurgeons in Nigeria, they treated his neck. Actually, the neurosurgeon that treated President Buhari's son that had a motorbike accident treated him. So I didn't get involved until 2 years later. So I went to meet the neurosurgeon. Okay, what happened? I'm going to treat this person. He said, Dave, don't waste your time. Because in medicine, they taught us that, once you're paralyzed, after 2 years, that's it. It doesn't come. He said, neurosurgeon, well respected. I told you he treated. So I said, okay, I know what I do. I believe in it. I have passion for it. I still go ahead. So 2 days after the first treatment, the boy that could just barely shake his hand, 2 days later, was able to move it a little bit, the right hand. The left hand is paralyzed. Was able to move it. Then we continued treatment. Then by 8 months, I started getting some improvement, because if it is kidney problem or the brain or the spinal cord, it takes longer. All those other diabetics, everything I show you is just one session, bingo. 2 months, they improve. So now, by 9 months, the guy was able to move, and he stand up to 80 degrees. By 12 months, he was able to go higher. And then on the left side, he started moving it a little bit. And then by 15 months, which is like 3 weeks ago when I saw him in Nigeria, he was already going over. And then also, the left hand that couldn't move, that was paralyzed, is now moving it more. So there's already reconnection in the spinal cord system. There's already regeneration. That's why they call it regenerative medicine. There are things that don't happen in medicine, it's happening. So the less than 2 minutes video, I played for you, and then I'm done. You can see, okay, where the injury is in his neck. So by the way, he was having contraction every 10 minutes. By 2 days later, that has reduced to, 2 in a day. And that's 2 days later. That's all. That was improvement from what he could do. So by 8 months, he started seeing improvement, but I didn't see him until 2 days later. Until 9 months later. You can see that compared to before. That's at 9 months. He's already doing that. So then the range of motions has increased on the right hand at 12 months. And then the left side I couldn't move at all. You can see that his range of motion has increased there. And then this is about 3 weeks later ago, while I was in Nigeria. So now you could move the hand all the way, the right hand over his head. He couldn't go that far before. And then look at the left, that he couldn't move at all. You see how far he could go now. So now, when this happens acutely and you treat the person, it takes 2 years for them to be able to walk. My patient, I didn't get to him until 2 years. Not like the standard of, so I expect that by 2 to 3 years, he should be able to, get up and start walking based on what studies have shown. Okay, thank you. That's all.
Just now, let's just give a thank you for what he's doing, not just here in the United States, but also in Nigeria. He's our pride and joy, Dr. Ikudayisi. God bless you, and God continue to uplift you. Thank you. Thank you so much.
NABN TV, inspiring a new generation.